You ask any nurse, back in nursing school, what was the hardest thing to learn about when it came to learning how to read ECGs? And I guarantee you, every last one of them is going to say learning the different types of heart block. I get it. It was kind of challenging, and nursing school made it way harder than what it actually needs to be. Well, rest assured, student nurses, new graduate nurses, stress no more. Your lifeline is here. Because on today's episode of Make It Make Sense Cardiology Edition, I am going to teach you the easiest way to not only recognize, but actually understand this one. Second degree AV block, both type 1 and type 2. Lock in. Let's learn. Before we get too far going into today's lesson, it is first imperative that you understand two things. Number one, you gotta understand the electrical conduction system of the heart. This is a specialized network of cardiac cells that has the very unique capability of being able to conduct electricity and fire it accordingly. And it's this firing of electricity that tells the chambers of the heart when to squeeze and when to relax. That squeezing and relaxing, that's your heartbeat. That is why electrophysiologists, these are the specialized cardiologists that deal with nothing but rhythms. They are dealing with the electrical system of the heart. These are your rhythm specialists, and these are the ones that put in the devices that do what the heart rhythm is not able to do on its own naturally. So if you've not familiarized yourself with the electrical conduction system of the heart, no worries. Hit pause right fast and then hit plus, that plus sign right there, and then go back into a previous post that I've done. It'll have a header just like this, and it'll say basic ECG interpretation. I promise it's the simplest explanation of the electrical conduction system of the heart. Once you've reviewed and familiarized yourself and you got a good understanding of that, then just come on back to the classroom. The door's always open. That's number one, understanding the electrical conduction system. Number two, it is vital that you understand that there is a difference between having a blockage and having a block. Two different pathways. A blockage deals with the plumbing system of the heart. There's a problem with the blood flow as it's coming through the arteries, the pipes of the heart. And there's the area on the other side of that blockage, heart muscle, that's not getting good blood flow. That is a blockage. We're not dealing with that when we're talking about this. We are talking about a block. A block is a delay in that electrical conduction system that we just talked about. There's poor communication somewhere along that pathway of that electrical conduction system. The name of the block will tell you where the delay is. You don't have to do any guesswork. The name tells you. Where you have to have a bit of a discerning eye is being able to recognize the block pattern on the ECG, and I'm going to help you out with that. Starting with, I told you I don't do all these little animations and pop-ups. I still haven't figured out how to do that, so I actually have printouts. And these are downloaded rhythm strips from the internet, so this is not a particular person. This is just for teaching and illustration purposes. Before I get into this, look at the name. Second degree AV block. The name will tell you where the delay in communication is. And also, I would be remiss if I didn't say this. A lot of us in nursing school, myself included, were taught to kind of associate the pairing of the P wave and the QRS complex as like a husband and wife deal, and one shows up a little bit late or doesn't come home, or there's, separation between the two. And I understand, why some would use that analogy to help explain this. Now, for me, maybe y'all were different, but for me, that just didn't click. Didn't jive with me whatsoever. What does work for me continuously is not to think as the P wave and the QRS complex as some husband-wife arrangement, but think of them as business partners. I would think of myself as the SA node and think of a business partner as the AV node. Now, our business is named Heart Enterprises, and the product that we produce is heartbeats. That made sense to me. Now, if you are going to do business, especially if you are going to be in partnership with somebody, the expectation is that I do my part, and then partner, you do your part. As long as I do my part like I'm supposed to, and you do your part like you're supposed to, business runs wonderfully. Our product is produced like it's supposed to be, and everybody's happy. With these heart blocks, AV Node's not doing their part. They're a bad partner. They're a bad partner, and there are consequences that come with bad partnerships. Now, let me show you what that partnership looks like in context of this rhythm right here. With second degree AV, atrioventricular block, it's going to be easier for you to recognize type 2 first, or at least it was for me. Remember, with the electrical conduction system, when the SA node fires to the AV node, that means that the top 2 chambers of the heart will contract. The atria will contract. That is reflective on the EKG as your P wave. All right? When the AV node receives its signal, immediately it should prompt the chambers on the bottom portion of the heart, those are your ventricles, to contract. So SA node fires, you got a P wave. AV node fires, you've got a QRS complex. There's your partnership, all right? Me, I'm the SA node. You can choose to be the SA node also, and then whomever your AV node partner is, let them remain nameless right now, because remember, they're bad business. All right, now let's illustrate. Do you see that? I've taken the liberty of marking the deflection waves accordingly. So starting at the beginning, me, P wave. I do my part, top 2 chambers contract. AV node fires, does its part, top 2 chambers, or bottom 2 chambers, sorry, contract. You see that next one? I show up, P wave. Where's my partner? Nowhere to be found. Next cycle, P wave, that's me. I show up, my partner shows up also, QRS complex, wonderful. Next sequence, same thing. They show up, beautiful. Next sequence, I show up. Where the hell is my partner? Gone. No call, no show, nothing. Do you see that? P wave, me. QRS complex, them. P wave, me. That one's not marked, but you can see it. QRS complex, they show up. P wave, unmarked, me. I'm showing up. Where's my partner? Nowhere to be found. So the distinguishing factor with the Mobitz 2, this is second degree AV block 2. The distinguishing factor is that me, P wave, shows up to work consistently like I'm supposed to. And then my partner, the AV node, who's responsible for stimulating the QRS complex, no call, no show. Don't know where he went. Just sometimes he comes, sometimes he doesn't. But when he does show up, he shows up in the right time. You see that? Immediately after I fire, there he is when he comes to work. But when he doesn't come to work, MIA, missing in action. You got that? All right, so that is Mobitz 2. Mobitz 2. Mobitz 1 takes a little bit more of a discerning eye, but still we are in the business. We're in the partnership. P-Wave me, I show up every single time. But that blame partner of mine, it's not that he no calls, no shows. It's that they just continuously come in late. Every single day, he comes in later and later until one day he just don't come in at all. Horrible, horrible work partner, horrible working relationship. You can't run a viable business like that. Let's take a look. Now, I did not mark it in the beginning because I want you to see it as you would see it on an EKG. But look here, P wave, that's me. I show up on time and there's my partner. Look at the distance between the P wave and the QRS complex. They show up right there when they're supposed to. And then next day, me, I show up like I'm supposed to. Oh, there's a little bit of distance between me and the QRS complex. He's starting to come in late. And see that again? You see that distance between the P and the QRS complex? Later, and then later, and then later, and then finally this son of a gun just don't even show up at all. Now, what kind of business relationship is that? Not good. That should give you, this illustration right here, hopefully, it gave you some insight into understanding what is happening when you have a heart block. Remember, a heart block is a delay in communication in the electrical conduction system. The AV blocks, as the name suggests, the AV blocks mean that the AV node is either not receiving its signal in the appropriate time frame, or it's not getting a signal at all, period. This is when you want to get the electrophysiologist involved, first and foremost. Second thing, as a nurse, student nurse especially, because you're going to have a lot more time to go over your patient's chart than will the already established nurse. So, you've got a little bit more time to do some due diligence. Look at your patient's medication regimen, because there are some medications that can contribute to those delays in conduction. These medications are called your AV nodal blockers. Most familiarly, you'll see beta blockers, your blood pressure medicines that end in that suffix LOL. So like metoprolol, carvedilol, propranolol, things like that. Or your negative chronotropic agents. These are medications that are purposed to slow down the heartbeats. Think along the lines of your non-DHP, that's dihydropyridine calcium channel blockers. These are your diltiazem and your verapamils. Those medications, metabolically speaking, the way that they work is they actually delay the communication between the SA node and the AV node. They purposely tell the heart to slow it down. That's why these medications are very, very popular and worthwhile when you have tachyarrhythmias like atrial fibrillation, atrial flutter, SVT, things like that. So look at your patient's medication list. Do you see any medications that could be causing a delayed heartbeat? If so, bring it to the attention, student nurses, bring it to the attention of your precepting nurse. Already assigned registered nurses, if you see medications like that, bring it to the attention of the attending provider and or the cardiologist. Always look for any sort of electrolyte disturbances. You're talking sodium, potassium, calcium, magnesium, the whole nine. Look at all of your electrolytes, because the electrical system of the heart is governed by electrolytes. Look for things like thyroid disorder, narcotic medication use. There's a whole lot of things that could cause AV node disruption or delays in communication between the SA node and the AV node. Take home point from today's class is that when you are looking at a heart block, you are specifically looking at a delay in communication between the SA node, P wave, and your AV node, QRS complex. And if you find a less than optimal business partner, call for help. Electrophysiologist, call for help. And if this is something that you see on telemetry, nurses, student nurses, if this is something you see on telemetry, get a 12-lead EKG to confirm. Because we want to be able, we cardiology want to be able to see whether or not this rhythm is truly present in all 12 leads, or if it's just something that could be misconstrued as something else by just looking on telemetry. And then last thing, sleep apnea is a big culprit for rhythms such as this. So if telemetry notifies you of such a rhythm, or you see such a rhythm on EKG, do not be surprised if one of the recommendations from the cardiologist is for the patient to follow up with a sleep specialist to get a sleep study done. I think I've hit the highlights. If you guys have any questions, you know how to reach me. Like, follow, repost, share, all that stuff. Drop me some lines in the comments. Let me know what you think. Did that help? the business partnership as opposed to the marital spat between husband and wife. I don't know, worked for me. Later.